Hi everybody, it's Dr. Magnifico from Vet and Probably.com. This is Hank. He is about an 8-year-old beagle. He was found 10 days ago lying in the backyard. His owners found him. When they brought him to me, he was what we call lateral recumbent, so he was lying on his side. He was very stiff, very rigid, so all 4 legs were out. His head and neck were really stiff. He was unable to stand, he was unable to walk, and if you touched him at all, he would cry out in pain. He was really painful everywhere. He had trembling, which he still has now, but he was not moving his head around at all, and he was really stiff and rigid. If this happens to your dog, a couple of things to do immediately. One, look for any signs of trauma. So the first thing we're going to worry about is, did he fall over? Did something happen? Is there some damage somewhere? So look him over from head to toe. You've got to be really careful because these guys tend to be really painful. When he came in, I suspected immediately that he had IVDD, that's intervertebral disc disease. If you look at my name or you look at my blog, I've got quite a few blogs on IVDD, so there's a lot of information there. The other thing that I want to do, so after you look for any signs of trauma, the next thing to do is to put, typically I'm going to say put a flea and tick preventative on. There's a disease called tick paralysis, so that's one of the things I worry about. So look for any evidence of any ticks, remove them, and then also put if they're not current on their tick preventative, put one on them. The next thing to do is to see your veterinarian. Go immediately to the veterinarian. Typically they're going to do an exam. If they suspect IVDD, they're going to want to do an x-ray too. X-rays can be somewhat insensitive, but they can give you some clue that there's no other trauma elsewhere. He was so painful that he was unable to move any of his limbs, but he did have what we call deep pain. So if you pinched his toes really tightly, so if you went in and you pinch it really tightly, he would both withdraw and he was painful. So that's really important. It says that the brain is talking to the limb, and that means the spinal cord is intact. So that's a really, really important prognostic indicator. The next thing that we did was we put him on supportive care. In my neck of the woods, the typical treatment for an acute intervertebral disc disease dog is we want to send them to a neurologist ASAP. They will do an MRI to confirm the evidence of disc trauma, and then they want to go right to surgery. The MRI is about $2,500 and the surgery is somewhere between $5,000 and $7,000. So for some of these guys, it's $7,000 to $10,000, which was cost prohibitive for his family. So they decided to do medical supportive care. I'm going to do another video about all of that, but this video is really about immediately, if you find your dog down, painful all over, unable to use the back legs or unable to use the front legs and back legs, go immediately to your veterinarian. Hopefully they're going to do an exam, they're going to do a radiograph. That should be probably about 100 or 200 bucks. Definitely want to address fleas and ticks, make sure there's no ticks on there because of tick paralysis. Look for any signs of trauma, and then we start talking about some of the neurologic diseases, and there are quite a few of them. Your veterinarian can work them up for you. If you have any questions, you can find me anytime at Probably.com, or you can find me here at Jaretville Vet. Take care and wish Hank well. He's doing much better. Say bye, Hank.
Bye.